Hello. Today we'll be reviewing how to run the fraud, waste, and abuse demonstration. The persona page will be your navigation hub, explaining the general overview of the demo, linking important resources, and providing the impersonation capabilities in a central location with explanation of each persona. The process begins with a case submission from an external integration system regarding a claim being flagged for the suspicion of fraud. The roles we will walk through are the fraud analyst and the proving manager. The analyst will review case details, create interactions, make a determination, and finalize the corrective actions. The approving manager will review their dashboard of the overall FWA process and approve cases. We'll begin impersonating the fraud analyst. Presenting us to the workspace landing page. This provides us a high-level case detail of their work and their team's work, utilizing metric visualizations to point out essential fields such as priority, my cases, and other case statuses such as the rejection codes, cases by organization, cases per team, claim scoring, as well as the status analysis. The list contains any of their in-progress cases. We'll go ahead and select the inbox and accept the case. Presenting us to the record view. This gives us a consolidated view of the required information needed to work cases without shifting platforms. The page is broken up into tabs with a contextual side panel that provides tools for the agent to handle the case. Details tab can be customized to show fields specific to the agent's needs and will get populated by case submission from an external integrated system, the portal, or agent updates. Some of the fields that we have are the responsible entity, investigation status. This field drives what types of playbooks get presented for cases, contract type, obligation number, so any custom fields that would need to come over from the outside system. We have case level tracking fields, case type, opened, the statuses, any HCLS data model information that's necessary, such as the claim header, being able to dive into it, and the provider or member. So let's say we get this case from that outside system, and it provides us the claim number, the provider's NPI number, and the member ID. With those values, we can go ahead and set up integrations with the payer's external systems of record, go and pull that information based on those IDs that were provided, and bring back relevant detail that would help build this surrounding data model around this case. And then we can just keep going down. We see any notes that can be added as well as closure information. To the right, we have Compose. So this tracks real-time updates to the case and provides audit history. Comments are for external contacts, in this case, the provider office manager. Work notes, these would be for internal agents, liaisons, or approving managers. And then below, the activity collects field changes, attachments, and comments with timestamps to provide clarity no matter where the agent picks up the case. The side panel to the right, this will show relevant case information that the agent wants to see at a glance. So let's say we're moving through these tabs, this will still be present for them to see. So that's nice to have the contact information as well displayed as a card, any SLA information tied to the case. So let's say we have multiple SLAs, they would be displayed in a card view that you can shift through. And then we also have a timeline that breaks out these specific SLAs in a more granular format so that you can kind of see maybe why this SLA was breached or about to be breached. And then moving down, we have Agent Assist. So this utilizes a specific field that we define. So for this use case, we have short description. It takes that short description and compares it against different content items to pull back relevant information for the agent to do their work. So we can do knowledge articles that come from an external knowledge base or an internal ServiceNow knowledge base that's set up, or previously worked cases that have a similar short description or metadata can be populated as well to help that agent find exactly what they need to do. We'll do attachments. So anything that comes in from an email submitted through a case or comment will get added here. And then we'll move to activity stream. This is just showing that we have different ways of presenting the same information. So right now we're utilizing the out-of-the-box layout for this record view, but we could always customize it further to fit the needs of the analyst. We'll move to the playbook and then touch on some of these tabs as we progress. The Playbook tab gives the reviewer a structured view of the business workflow. Interacting with the workflow in real time from within the workspace, agents can use playbooks to update records, upload attachments, and complete tasks across multiple workflow activities in line with the case. Another excellent feature is the ability to show the case story to an agent that gets past the case after being initially worked on, seeing who and what has been done to further ensure responsive passing on of knowledge. Walking through the playbook, we see it's broken up into categories. We'll start by reviewing claim details. We can present key fields within this playbook view, such as the member, the type of claim, the date submitted, financial claim information, the service provider. If we need to, we can also click in deeper and see the claim details and any associated claim lines. So this is utilizing the data model well. We'll go to review practitioner information, have a different layout. We see their name, NPI number, date of birth, street address, and state. We can also see more information as well if we click into the provider. We can see more detail, any practitioner locations, specialties, claim headers, and payer cases. So that's a good way of seeing if this individual's got multiple fraud or waste cases tied to them. So you can see the exposure easily and who else is working on these cases and can possibly find ways to work together to resolve this issue. Next, we'll view the member information. Same idea. We have another way of displaying member information in a page view. So this takes that data model and breaks it out so that we can see the insurance information in one card, any of their interactions, case history, FWA case history, conditions, medications, allergies, and then if they've been tied to other duplicate claim rates or claim rejection rates. So it just kind of helps give you an overview rather than looking at this breakout in a tabbed form. We'll request information. So this is just an example of us retrieving demographic information based on the member that's tied to the case. And we pulled back the phone number from Cerner Sandbox. We can create a patient interaction record, populating the type and a short description, just saying that we're going to do a phone call. So let's say the agent uses a CTI phone integration. We can mimic that and just say that we didn't reach the patient and go ahead and save. Any interaction records can just get tied to the case as well in this tab. And then we'll move on to an interaction with the provider. So this is a different setup where we have a strict email option, and it pre-populates with some general text to help guide the analyst. Now that we have acquired all the right information, we'll start with our determination. We'll go ahead and fill out, have you filled numerous identical prescriptions for this beneficiary possibly? Yes, based on looking at the member information tab. Does the sponsor encourage or support inappropriate risk adjustment? Is the other no. We'll select. Billing configuration. Billing for non-covered services using the incorrect CPT, HCPCS, and diagnosis codes. Billing for more units than rendered, we'll go with. Coding issues, modifier misuse. Treatment issues, altercation of records to get services covered. Risk factors, since we have too many options, we'll go ahead and select update first to get the pop-up modal, and we'll select data entry as a risk factor, denials, and then upcoding. Okay. We'll confirm the results of our investigation. We'll keep it at fraud. Let's say we did select can't make a determination. This could be a good way of initiating a new playbook to have a different agent that's maybe more skilled, or a manager look into this. And then for reason for status, we'll keep it easy and say obvious case of fraud because, and the main gist is that there's errors going on with the CPT and diagnosis codes that are being used within this claim. They're not matching up with the prior authorization or the procedure. There's inconsistencies. So we're going to go with this being fraud since the inconsistencies are so blatant rather than it being submitted under a mistake. Corrective action will begin with a training and education task. We'll create this for the education team, stating the configuration item will be Plexus that we need to educate the provider on, stating set up a meeting with the office and go over industry standards for submitting a claim. We'll refer this to an outside agency for further investigation, OIG. Combating fraud. We'll select, is there suspicion of criminal healthcare fraud? Yes. Pushing us to results, we can create an impact analysis record. So let's say when we were reviewing this provider's information, we saw that they had multiple cases out for fraud. We could go ahead and create this analysis, add the affected claims that we found, total cost, and a description. Save this for further investigation of the total impact of this provider's fraud, waste, or abuse. Now we're ready for the manager's approval. We can see that this playbook step does not let us progress any further. We'll exit out, unimpersonate, and then impersonate the approving manager. We see a slightly different view than we did for the analyst. The approving manager is going to have a visual of the whole FWA process, looking at key indicators such as breached SLAs, open cases, and unassigned cases, displaying a list of cases awaiting approval. Coming down, we see investigation status, rejection codes, cases per team, investigation statuses per service organization. So we have the organization at the bottom and then the status broken out, just giving us an easy way to see if there's any bottlenecks or reasons why one agent is having difficulties closing cases or a service organization has too many cases coming in. Moving back to the top, we'll go ahead and select the case needing approval. Head to the playbook. The step displays case information that came in from the initial integration, the analyst's findings, as well as a location to add, approve, or comment. We'll go ahead and agree with the findings and approve. These final steps are instructionals, just letting us know that they're sending the claim to an outside agency for further fraud investigation. All future claims can be flagged for this organization, and organization may be added to the LEIE list for future claims. We have validation that the external claim system has been updated, as well as the PIT rules engine to handle this claim situation. Completing the flow. We can go ahead and close out, end impersonation, return to the dashboard, and reset data for our next attempt.